Now let us look at this question. What are the public health measures which helped in containing COVID-19 infection in India? So they are asking about COVID-19 infection. COVID-19, remember they are asking what? COVID-19, which came in 2019, towards the end of 2019, I think. And what did India do to contain this virus? Okay, what were the public health measures? Okay, so let us look at the answer to this question. They've asked for 3 marks, so let us quickly write hopefully like 6 headings, let us say half mark each or something maybe. Okay, so the public measures, health measures that helped India contain the spread of COVID-19. First of all, what did they do? First of all, there was lockdown, right? You have to write this. March 2020 sometime it started. Right, so nationwide lockdown, travel restrictions and border control, this came, right? And then what happened, there was some in the travel restrictions, there was screening, if somebody has traveled, quarantining, all these words they are looking for, guys. You write that. Then COVID appropriate behavior they promoted. First they did the lockdown, restricted everybody from movement. Then what they did, COVID appropriate behavior, that is mask. You have to use mask, hand hygiene, social distance. These 3 words should come. They made you wear mask, hand hygiene, and so that you use that hand sanitizer. No, all of us used. And then social distancing. And then they use celebrities. Okay, so they also use celebrities, guys. Celebrities were brought in. So influencers to promote that message. Okay, then let us go to the next point that we want to write here. After the COVID appropriate behavior, you have to say that they also did some screening, surveillance systems. You'll track contact tracing and widespread testing and surveillance. Okay, and wherever they found a positive case, they did localized containment zones. Okay, then. So we have looked at 5 points. Now let us look at another 5. Health infrastructure we had to strengthen. So oxygen plants, you remember, right? They looked for ventilators, beds, ICU beds. You know, they classified beds as what is that? High risk, etc. beds. Okay. Then COVID care centers were set up. Then temporary hospitals, quarantine facilities. So basically some health infrastructure were set up. Oxygen plants, I think you can remember. Everybody was running around looking for this. Okay. Then can you see, or do you want me to zoom? Okay, training and capacity building. Training and capacity building, we trained all our health workers to go do this testing and make people aware of the containment zone, etc., etc. And later when the vaccines were ready, how to administer vaccine and etc. Then we had to come to digital apps, okay, some AarogyaSetu app, etc., contact tracing, and some Covin platform for vaccination registry, etc. All that Covin app also you write, and then AarogyaSetu also you write, okay, if you can remember. Then let's go to the last 2 points here. Then PPE kits they wanted, so we had to manufacture indigenously, that is within our country we had to manufacture all this. And then diagnostic kits also we needed, so we started manufacturing all this internally. Then lastly, I am putting the vaccination drive. Vaccination drive, basically we had 2 vaccines. We had the Covishield vaccine from the Serum Institute of India. Actually this came from the, I think Oxford and AstraZeneca or something. So developed by them, manufactured in India, they are saying Covishield. Covaxin by Bharat Biotech India. So Covaxin, what they are saying is totally vaccine is from India only. So these 2 options were available to people, right? So Covishield, you can see here, Covishield was Oxford and AstraZeneca, developed by them, manufactured by Serum Institute of India. Covaxin is from Hyderabad based by Bharat Biotech. Okay, so this is, they are saying Covaxin was Indian. Okay. So if you see the question, it is in past tense. They're asking what did we do only. What are we doing? They have not asked. Okay, what are they asking? So you can just say that even currently we're doing a lot of research and trials to build better vaccines. Okay, fine. That's all for now. Thank you.